This is a video on intermittent urinary catheter insertion and removal. To start, the nurse is going to perform hand hygiene, provide patient privacy, introduce self to patient and family.
Good morning, my name is Kelly. I'm going to be inserting an indwelling straight cath.
And explain the indication for intermittent urinary catheter.
At this time, we need to empty out your bladder, keep it emptying out and stuff, so I'm going to be placing this straight cath into you.
And check 2 patient identifiers.
I'm just going to check your armband here. Can you tell me your first and last name and your date of birth? Perfect, thank you.
Next, the nurse is going to don clean gloves. Place the patient in a supine position. For the female, we'll flex the knees. Next, she will perform perineal wash with peri-wash solution or soap and water and allow to dry.
I'm just going to be cleaning you off.
Next, the nurse will discard her gloves, organize the work area, and position the trash receptacle nearby. And then perform hand hygiene with alcohol hand sanitizer. Next, she will reapply new clean gloves and open the sterile catheter kit. First, she's going to remove the sterile gloves and place them on the bedside table. And then remove the drape by touching only the corners and placing the sterile pad shiny side down underneath the buttocks. While maintaining aseptic technique, the nurse will next don sterile gloves. Next, you will position the fenestrated drape on the patient appropriately. Organize the kit supplies on the sterile field, maintaining sterility. Next, you will open the stick end of the aseptic swabs. You'll also open the specimen container and place the lid on the sterile field. And then open the lubricating gel and lubricate the first 5 to 7 inches of catheter. Next, you will clean the urinary meatus of the patient appropriately. You'll clean this with the antiseptic swab sticks.
I'm just cleaning you off, okay? You might be able to feel this a little bit.
Next, with your sterile dominant hand, pick up the catheter, holding 2 to 3 inches from the tip. You will coil the remaining catheter in your hand and with the distal end placed inside the container. Insert the catheter until urine starts to flow. Collect urine in the appropriate collection container. And when the urine stops and the bladder is empty, pinch the catheter and slowly withdraw from the meatus.
Okay, I'm going to go ahead and pull this out.
You You will remove the urine-filled receptacles and set aside to be measured and emptied. Cap the collection container using sterile technique if a sample is needed. Next, you will cleanse and dry the patient's perineal area. Discard catheter supplies according to hospital policy. Remove your gloves and perform hand hygiene.
Just cleaning you off. We're all done now.
And next, you will return your patient to a position of comfort with their call device within reach.
All right, your call light's right here. If you need me for anything, you just hit your call light and I'll be back. Are you in a comfortable position? No pain? Your call light's right here and you have your water here next to you. I'll be back in a little bit.
And last, you will document the procedure and urinary assessment findings.